What do we not know about the human body? Story 1. I have a very niche answer. We don't know what is supposed to naturally bind to the area that benzodiazepines work at. Benzodiazepines, BZD, are medications like Xanax and Valium. They produce anti-anxiety effects, and they have a very distinct chemical shape to fit into the BZD site, in a group of 5 proteins. But we don't know what is supposed to go there. Many medications are analogs of naturally binding molecules that we copy and then use to create an effect. The BZD site is for something, we just don't know what. Reply 1. This is super interesting. Since we don't know what naturally binds there, does that mean we don't know what those receptors naturally do or what they're naturally for? Reply 2. There's an endogenous ligand that normally binds to the BZD site, endozapines. Proteins like diazepam binding inhibitor, DBI, or its fragments, octadecanoeuropeptide, ODN, that reduce GABAergic inhibition bind there. But this is only a partial answer. Research is still ongoing on what its exact binding partner is. However, we do know that metabolites of progesterone, allopregnanolone, and others can enhance GABA-A receptor function by binding to distinct but related sites. Reply 3. For my fellow pop girls who need it in simpler terms, imagine your brain is like an exclusive VIP club. There's a special lounge in this club called the BZD room, and it's prime real estate. Medications like Xanax and Valium, they're the A-list celebrities who get instant access. They walk right in, chill on the velvet couches, and bring a super calm, chill vibe to the whole place. No anxiety allowed. But here's the scandal. Nobody knows who was originally supposed to be in that room. Normally in VIP sections, there's a regular guest list, natural body chemicals that the space was made for. But in this case, we have no idea who's on that list. It's like the BZD room was built for someone important, but they ghosted. And now Xanax and Valium are throwing the party instead. Scientists are basically standing outside the rope line like, wasn't there someone else supposed to be here? But no one knows. So for now, benzodiazepines own the room. Total mystery, total intrigue, very Hollywood who's who, but make it neuroscience. Reply 4. Are benzos as dangerous as everyone says they are? Low-dose benzos are the only thing that makes me feel normal without making me feel drunk or genuinely under the influence all day. But my doctor says they're too dangerous for long-term use. Conversely, 2 of the meds that I do take have been said to lead to dementia, so at this point, I feel like I have to choose between being crazy now or later. Brains are weird. Reply 5. It really just depends on what is meant by dangerous. They have a relatively high therapeutic index, and so they are hard to fatally overdose on, especially compared to their predecessor, barbiturates. That being said, like almost all drugs, tolerance will develop with regular use, and higher doses will be needed to get the same effect. The main danger people talk about is their withdrawal. If they are suddenly discontinued after tolerance is established, the withdrawal can be agonizing or even fatal in extreme cases. As long as you're aware of the risks, take the smallest effective dose, and only when needed, the harms can be substantially minimized. Story 2. One of the few absolutes in medical science is that nobody born blind has ever developed schizophrenia. Reply 1. This fact is so goddamn interesting because to me, I will say not at all educated in neuroscience or psychology, that has to mean that schizophrenia is intrinsically linked with vision specifically, because even though people with schizophrenia have visual and auditory hallucinations, born deaf people have been known to develop it. So what makes being able to see such an important factor in getting it? I need smart people to figure it out stat. Reply 2. Just adding to this, that's why a lot of current schizophrenia treatments aim to address vision problems first. That is, getting eyes tested for needing glasses, sometimes surgery on the eyes. Reply 3. Purely anecdotally. For a couple of years in my life, I had crap vision. Broke a pair of glasses, had to use old glasses. Thought they were just good enough, but I just got used to it. And that happened to coincide with a period of bad mental health and brain fog. It's entirely possible it was just coincidence. As in, when I got my mental health together, I finally got my vision corrected. But something about the world being blurry definitely screws with your head too in and of itself. I felt like I actively taught slower. I didn't try this, but I should have. I genuinely think I would have been worse at, for example, taking an IQ test then, even though I would have been able to see a test sheet fine. Reply 4. I recently learned that people who struggle with auditory hallucinations hear voices differently based on their culture. In Western-like cultures where we are an independent self, the voices are unfamiliar and often angry. In cultures where family and community is a single unit, the voices are often those of loved ones giving reminders and typically kinder. Reply 5. I am by no means any expert at anything, but it kind of makes sense. I had an idea that schizophrenia definitely seems like a form of overstimulation in general for the brain. So if you took away one of the hardest stimulating things, sight, it reduces overall activity. Or another thing is the way the brain tends to reroute senses for blind people. It goes and misses the highways that like to cause schizophrenia. Reply 6. One of the most simple and most important rules, correlation doesn't equal causation. But because I believe in always staying curious, these questions always need to be explored in case it truly is linked. I wonder if it is rooted in how impactful visual hallucinations are. Imagine the dissonance of, say, having your eyes tell you that the face peeking out from the doorway is real when your brain reminds you that you live alone. That kind of experience must push a person farther into an unstable mental state than auditory hallucinations alone. But even that is arguable, and that hangs on the idea that initially mild symptoms can spiral a disorder into a more severe disorder. I don't know. I wish I had read more research on this, and I wish that more existed. These are just the ramblings of a currently sleep-deprived mental health counselor with a degree in psych. Story 3. OBGYN. Here, we still don't know exactly what makes labor start. We know all about the mechanics and physiology, but we don't know what makes the average uterus say it's go time. Reply 1. Endometriosis patient here. We still don't know why OBGYNs still aren't being trained about common health issues like endometriosis. Especially when endo affects 10 to 20% of all women, and it's in the top 10 most painful conditions in the world, and a leading cause of both infertility and ovarian cancer. We don't know what causes endometriosis, but we do know that it grows like cancer. It's been found in every organ of the body: lungs, hearts, brains, legs, sinuses, eyeballs. We don't know why. We still don't know how to prevent endometriosis from growing back. There's no cure. Not a hysterectomy, not pregnancy, not birth control or surgery. These are tools for symptom management. They are not curative for the majority of women. We don't know how to treat complicated cases of endometriosis like thoracic endometriosis, which can be fatal due to pneumothorax, meaning lung collapse from endo lesions, or pericardial endometriosis, endo on the tissue around the heart. So women with the more rare types of endo are subjected to surgery after surgery, hormone after hormone, without any relief or hope for improvement. We still don't know why 99% of gynos dismiss and gaslight women in pain by telling them, your pain can't be that bad, or it's just anxiety, or all women have pain. We certainly don't know why it takes women 10-20 years to get diagnosed with endometriosis when they're constantly begging for help. Sarcasm. We do know why. Gynos prioritize profits over human suffering. Babies are more profitable to big medical groups versus treating women in pain. This is a global problem. It's not just the US. OBGYNs are failing the very population they swore an oath to protect and serve. See how the OBGYN op here prioritized a comment on labor and delivery over the millions of unknowns with endo, adenomyosis, PCOS, fibroids, etc. The financial incentives are not there for OBGYNs to care about anything else. Women deserve better. Hey gynos, wake up and stop gaslighting your female patients who are complaining for years about pain. Put your fragile egos aside and refer them to someone who can actually help. Minimally invasive GYN excision surgeon. And FFS, stop pretending you know how to do these surgeries when all of the research shows that you will do more harm than an actual expert. Or maybe, and I'll hold your hand when I say this, try out some continuing education. Try Googling symptoms of endometriosis or PCOS or adenomyosis. Try to learn how to better support all of your patients, not just the ones interested in having a child. Sincerely, someone who begged 30 different gynecologists in the US to help her with her extreme pain over 20 years, who was later diagnosed with stage 4 deep endo in 26 places through surgery with an expert. Story 4. I'm an anesthesiologist. We still don't really know why inhaled volatile anesthetics like sevoflurane, the principal anesthetic agent used to maintain general anesthesia, work. We kind of have an idea of maybe how it happens, but really we don't know. It's commonly said in my field that whoever figures this out will win the next Nobel Prize in medicine. Reply 1. I remember the time after my first stay at a hospital. The stay itself was okay and of course frightening, but my experience was not a negative one. It was just a minor procedure, and I left the next day. In the evening of the same day after the operation, I took a picture for my wife of me lying in the hospital bed. Not a selfie, but just how I was lying there from my perspective. A few months later, I found the picture on my phone and had a strange reaction to it. I got fear, anxiety, got nauseous, and felt threatened. The picture just showed my body in the silly hospital gown, the bed, and a part of the room. It was a boring picture, but my unconscious reaction was like something bad had happened, and that this picture was horror. I had to delete it as all these feelings became more overwhelming the longer I looked at it. Reply 2. I did some research many years ago in this area. Well, kind of. We were trying to build a wireless, then early 3G operating room, etc. Actually took radio technologies another 20 years to catch up with 5G for the power levels we needed. But brain monitoring and the data from anesthetic machines makes for great data sources and easy implementation. Got into many discussions about anesthesia, consciousness, etc., and the work by Roger Penrose and Stuart Hameroff, who think that consciousness arises from structures right on the edge of quantum and classical mechanisms. Most people think they are completely wrong and utterly crazy, but at the same time, admitting that A, there is no better theory, and B, it is crazy enough to be right. Reply 3. I've been fortunate enough to only have 2 surgeries that I had to be put under for, but the anesthesiologists were truly the MVPs, also the kindest about checking in on how I felt going in. Second and dumber, perhaps it makes your brain time travel while the body's having everything done. I swear, I was so unprepared for the blink and you're looking at a different ceiling and it's actually 8 hours later experience. Reply 4. Yes, I just turned 43 and had my first surgery a few months before I turned 42, and my second surgery a couple weeks before 42. My first surgery lasted several hours and the second was much shorter. At the time of my first surgery, I had, well, still have, twins that were weeks from being 3. They are the youngest in a football-sized family, so I hadn't slept in years. But after twins, the sleep deprivation was literally killing me. I don't even remember being sedated, and always assumed that you are disoriented and confused when coming to. But to my surprise and my nurses that began with the questioning, I was sharper and more aware than I had been over the past 3+ years. It was a sleep that I guess I desperately needed, but like you said, I wasn't prepared for all of the sudden, okay, you don't have to go home, but you can't stay here. My second surgery did leave me feeling more tired and out of sorts, but again, it was a much shorter procedure. Anyway, this concludes my oversharing. Story 5. Doctor here. Off the top of my head, here's a few deceptively big ones. 1. We still aren't exactly sure how anesthesia works. We just know it causes certain effects, and they are useful, so we use it. 2. Psychiatry is still shockingly infantile in our understanding of human disorders. It's constantly in a state of flux. We don't understand a lot about the meds we currently use, and the diagnostic criteria for disorders still changes as we realize, hey, maybe all these behaviors aren't the same source disorder. It's incredibly hard to diagnose when the criteria is largely based on self-report and subjective observations. 3. To a lesser degree than #2, neurology is still learning a lot. It's further because you can observe more objective findings in neuro than psych, but we still struggle a lot with how brains function. 4. Immunology, don't even ask me because no one knows really. 5. Yawns. Still guessing on why that happens too. There's some theories, but that's the best we got. Reply 1. Regarding 2 and 3, I had a major traumatic brain injury about a decade ago. Shockingly, there was no neck damage, despite the cause of the injury. Rotational fall from the horse with a skull fracture from being kicked as the horse fell over me. I was up and walking 45 minutes after a rotational fall without a helmet, which basically means that I have the best guardian angel in history or something. But the after effects of the TBI were really strange. It would take way more time to fully write out on my phone's keyboard than I'm willing to spend right now, but it caused such a shift in my personality. For the longest time, I felt like my soul was broken. One of the most comforting things, though, was going through neuropsych testing and finding there was no statistically significant change in my cognitive abilities from the accident. I had neuropsych testing data from before the accident. which was probably interesting for the doctor. I don't know how many cases there are of somebody with neuropsych testing from before and after a major TBI. But it didn't help with the "why do I feel like I'm wrong inside" question. Finally, I came to realize that our brains and minds are wholly biological. A big impact is enough to change us fundamentally, which means that everything we are is physically there. I felt different because I became different. In a way, it's like the old me died at 19 and the new me was born. Reply 2. I'm a TBI survivor too, skull fracture and subdural hematoma. It was 2021, which puts it at 4 years ago, so I was 28. I turned 32 this year. My memory is very bad, but I'm not sure that isn't caused by other things in my life. Depression, CPTSD, etc. I feel like a completely different person since the brain injury. It's not all bad, but unfortunately I feel like damaged goods now. There are things I want to do in my life like dating, career advancement, etc. But I wonder if I have the capacity to do those things after the injury. Reply 3. That's exactly what I had. Mine was in late 2013 and I turned 32 next month. I still remember the horse falling and thinking, crap. I remember waking up on my back in the mud, with EMTs cutting off my coat and shirt. My mouth was full of dirt and my head felt like it was spinning. I asked the EMTs if they were cutting off my coat and they said, yep, and I just said, crap. They clamped a C-collar around my neck and cinched me down on a backboard. I was loaded up into an ambulance and they slammed the door and took off. I thought about the countless horse riders who became quadriplegics from rotational falls, and I closed my eyes and tapped the toes of my boots together. Thump, thump, thump. I couldn't see them because of the backboard and C-collar, but I could hear them and I could feel my toes wiggling inside of my boots. I breathed a deep sigh of relief because at that point, I knew I could at least still walk. I knew things wouldn't be like that. And I know exactly where you're at. I know it's a weird place. And you've probably felt alone, or like the professionals you've talked to don't understand what you're feeling inside because they almost certainly don't. It's impossibly difficult to describe how those changes feel. For a long time, I felt like I should have died. I felt like my soul was broken, like I was broken, and I was angry about the fact that I even existed in the first place. I drank a fair amount, which did absolutely nothing good for me, and I went through therapy that didn't help and psychiatry that didn't help. And I got married, which really didn't help. And I bounced around and made all sorts of stupid and self-destructive 20-something mistakes because I wasn't sure why I was even alive. It wasn't that I wanted to die, but rather more like I didn't understand my place. I didn't understand what was happening to me. I was angry for a lot of reasons and for no reason. I had poor impulse control and poor emotional control. I'd just lose my cool sometimes. This happened for a long time. My brain just wasn't firing correctly. Connections and pathways that used to be there weren't there or were different or whatever the science may be. But the point was that there was something physically wrong. It was an injury, and I needed to heal. The only thing that can really heal this wound is time. It's a physical injury. You are not bad, broken, less than, or spiritually inferior now that this physical thing has happened to you. It's simply a thing that happened, and you are healing with every passing moment. You are learning to be yourself. I feel like a completely different person since the brain injury you are, and that's not a bad thing. It is, however, a bad thing to think of yourself in terms of the old you, because you're never going to be the same. I know that's a tough thing to hear, but when I finally worked that out, I stopped feeling so out of place, and I became free to start getting to know the new me, so to speak. I became free to live my life, the life I'm fortunate to have, instead of spending my life wishing for my old life back. It's frightening to think about it, and almost nobody in your life will understand this. My parents really like to say, "We need to get you back." And when I started doing better, "I think you're back." I'd tell them, "No, I'm not back. I'm still different, and there is no way back. I can only go forward from here. You can only go forward from here." Unfortunately, I feel like damaged goods now. Who among us isn't? But seriously, you'll have your struggles, and that's a part of life. But as your brain heals, you will feel better. Brains are weird organs. Doctors don't really understand what's going on inside of them, after all. But one thing I've found is that the brain has an incredible capacity to adapt and heal. You won't heal backwards. Your brain will mend itself forward from here. Your mind will be like kintsugi, an artifact that was broken but is repaired into something new and, in its own way, beautiful. The hospital gave me back the cut-up remains of my coat after the accident. A dear friend of mine sewed it back together for me, and it remains a treasured possession. It has a long and crooked seam from where it was cut and then stitched, and when I wear it, I remember that I'm alive. There are things I want to do in my life, like dating, career advancement, etc., but I wonder if I have the capacity to do those things after the injury. Then these are the things you will do in your life. I've dated, to varying degrees of success, but I was married for a while and I found I still have the capacity to love and connect with other people. I struggled hard to find a career, but I ended up in a field I do well in, and I've managed to crawl up from literally working in a factory for not much more than minimum wage to being a manufacturer sales representative for a number of brands that I'm deeply passionate for, and I'm in a position where I get to travel, set my own schedule, and experience things I never thought I would. It may not be easy to get there, and it was not always easy for me, and it still isn't easy at times. But you can get there. Just don't try to compete with the ghost of your former self. You can only go forward from here. 11.5 years after my injury, and I think I'm in a place where I'm happy with the new me. I'm happy with my imperfect life and my imperfect self. I have a career that I enjoy, hobbies I love, and dreams that keep me alive and going forward. And there are good days and bad days, and days where I still have worries and doubts. But those are balanced by all the wonderful and terrible things I've experienced, because I'm alive right now. Those experiences will feel both familiar and new simultaneously. The pieces of your old self will come into balance with the totality of who you are right now. It won't happen tomorrow, or in a week, or all at the same time, but eventually you will find that you've learned to be yourself, and you will go forward from there. Story 6. There's still a lot about the immune system that's undiscovered. Reply 1. I have ulcerative colitis, an autoimmune disease that causes inflammation of the large colon for those that don't know. And whenever that flares, my kidneys also flare and I get interstitial nephritis, which I'm told is highly unusual. I gave permission for a colleague of my gastroenterology consultant to write a paper about me. All my autoimmune problems started a few weeks after a strong course of antibiotics I took for a gum abscess. I believe the microbiome of bacteria in the intestines is a big part of my condition. Curiously, I've been symptom and medication-free since having children, I'm a male, because I have this theory that I may have replenished or rebalanced my gut flora by sharing food with my kids since they were babies, and them generally being disgusting and drooling everywhere, etc. Reply 2. Yay, there are decades of research on just immunotherapy for cancer alone, and currently no one knows why the same treatment works on some people with the same cancer, while there is no response in others. Clinical studies on most immunotherapy drugs have their response rate only like in the 20% to 40% of their patients. The immune system is so complex that research barely touches on the surface of it. One example of complexity is like people who take a specific probiotic fares better in certain cancer being treated by a specific immunotherapy regime, or that people who were on antibiotics before or during immunotherapy have a higher mortality, so research now involves the importance of microbiome in treating cancer. At this point, I think scientists just know some stuff is correlated with the immune system working a certain way, just that they still can't explain why. Not a medical professional, just read a lot of published medical papers due to cancer-related issues. Someone else with more knowledge can probably expand or correct me if I'm wrong. Story 7. I had a lecturer at medical school say, "Half of medicine is made up, we just don't know which half." Reply 1. On a similar note, I had a lecturer in med school show us a chart that showed the percentage of what we do in each specialty that has been proven by double-blinded, randomized control trials. It was an exercise to show that while family medicine or internal medicine might be at 20 to 30%, and orthopedics at 5%, vaccines are at 100%. Now, obviously not everything in medicine can be put through the rigors of the highest level of medicine. It made me think about the percentage of what we do that is based on the lowest level anecdotal evidence. Reply 2. I once had a job that was exploding so rapidly that they didn't want anyone to take time off. I had a scheduled vacation and it wasn't refundable, so I lied. I claimed I was partially blind in one eye and was having this new type of surgery where they'd peel back the cornea and fix what was inside. Mind you, this was in the late 80s. I arranged to take a week off work for healing because I worked in a very dusty environment. I got busted because my work sent me flowers at the hospital, only to have them sent back from the hospital because I wasn't there. I lied again and said I was allowed to go home right away as it was an outpatient procedure. I also put a patch on my eye and went into work to further the BS. But my eye healed miraculously fast, and a week later, I didn't need it. I don't know if they believed me. As it turns out, my BS was not only plausible, but factual. They were in the early stages of trying LASIK surgery. It does heal rapidly, and the hospital to which I claim to have gone was in the trial stage with volunteers at that very time. I firmly believe my guardian angel of BS was watching over me that week. Story 8. I'm a sleep specialist. While we do have some good theories about some of the functions of REM as far as how it affects the brain and health, we still don't fully understand the purpose of dreaming. Like, why do we dream at all, and why do dreams have a narrative instead of random, incomprehensible imagery? Unfortunately, this is unlikely to even be solved. Reply 1. I think it might just be a matter of us having consciousness. When our consciousness does not have any senses to work on and is basically cut off from our bodies. It doesn't just stop running, it just has to make up scenarios. It might not have any purpose at all, and just be a thing our consciousness invents when it is blocked off from being active. Or, for a crazier theory, we are seeing other realities. Reply 2. Right. You notice dreams are only remembered when you are beginning to awaken. Thus, your conscious mind is activating, becoming engaged. But all it has are these seemingly random housekeeping tasks that the brain does while you are sleeping, likely memory sorting, strengthening. So your conscious mind is trying to make sense of the random brain activity. It often tries to put it in story form, but the story is weird. Add in whatever emotional turmoil you are going through, and you have dreams that don't make sense but somehow seem important. Reply 3. I noticed this funny thing about dreams and REM sleep. I meditate a lot, usually with the aim of equanimity, weeks in a row of 2 hours a day. Whenever I'm in such a meditation period, I remember no dreams at all, and my watch keeps saying I barely had any REM sleep at all. Sometimes there are a few weeks where I fall out of the meditation habit, like when I experience a few sick days and then struggle for several weeks to pick up the habit again. In those periods, I progressively dream more and wake up more during the night. Also, my watch suddenly registers REM sleep a lot more too. Whenever I pick up the daily meditation again, dreaming and REM decrease again. I know smartwatches are by no means perfect REM trackers, but I cannot deny that meditation affects my dream cycles for sure. Reply 4. And why do some people have intense dreams? Mine are so vivid with proper storytelling, even if somewhat illogical, brilliant color. I often can remember them for days, and some I still remember 10 plus years on. I sometimes have places or people that feature in dreams months apart. The emotions hit me as well. I'll wake up upset from a dream, and that sits with me all day until I process it. If I have that kind of intense dreaming, then why isn't it always happy to bolster my mood? And who are these people who visit me a lot? And how do I know someone is in my dream when they look totally different? Like, yep, that is Sarah, even though it looks nothing like her. If it's Sarah, why doesn't my brain make her look like Sarah? Reply 5. I noticed for myself that all my dreams are based and incorporate things that I'd encountered throughout the day that I had forgotten about during the day. I started a technique called unwinding my day before bed, where I just recount my day to avoid nightmares. And now, I don't get them anymore. So I always assumed that sleeping was a cleanup step to your day to transfer memories into a longer form of storage, and dreams brought those ideas, thoughts I forgot back to the front of mind. As for narrative, I think it has something to do with how we establish memories. We are more likely to store them deeper if established to a narrative. Think the mind palace exercise. Reply 6. I had daily nightmares and copious dreaming, plus sleep talking and walking. I can remember this since about 4 years old, and I'm 43 now. Did a sleep study for migraine to check for sleep apnea, and was having 6 episodes per hour, which is minimal, but still positive. CPAP has completely changed the way I sleep. Basically no nightmares. My dreams are smaller, less joined up, and less lucid. I'm acting out less too, though I do occasionally chatter still. I had an episode when I fell asleep without CPAP once, and I had a nightmare triggered by it, and my instinct is to wake up when I have nightmares, so I think it's protective in some way. Story 9. One I didn't see mentioned. We apparently don't know precisely how our bodies can distinguish gas from poop. We have some ideas. We know there are a ton of nerve endings in the area, but the precise mechanism of our bodies telling our brains, this is a fart, let loose, isn't really understood. What blows my mind is, it's distinct enough that we even pass gas while asleep. That difference must be wired deep. Story 10. How basically any of medical science works in relation to women and their bodies. Almost all the data is based on men, and a lot of it almost exclusively. Reply 1. This drives me crazy. The rules on clinical trials need to change to ensure that both genders are represented in the study findings. Selection criteria is always healthy men and postmenopausal women, when women's hormones have a massive impact on health for most of their lives, and it remains unstudied. Being a woman is difficult when it comes to receiving care. The answer to many ailments is anxiety, depression, and being a woman, FFS. Viagra, a drug found to significantly improve period pain. An actual thing that most women deal with every month. The research was canned, the drug isn't licensed for women. Meanwhile, men are gifted erections because it was studied widely. Men's pleasure is more important than the pain women face for nearly a quarter of their fertile lives. Reply 2. While it is certainly true that medical science prioritizes men's health, my understanding is that medical research on female neurology and hormones is hamstrung by a surprising problem. Animal models work for men, but not for women. A male human has a lot more in common with a male rat than a female human has with a female rat. For example, male human libido is primarily governed by testosterone, just like a rat's. Female lab animals, and most mammals, however, have an estrous cycle, which humans don't. We can induce sexual activity through hormone manipulation in a female rat, but we have no idea how it works for female humans. The hormones that cause a rat to want to have sex do not have the same effect on women. Because of the animal model problem, the only way to understand a woman's hormones and neurology, as well as we understand a man's, would be to do horrifying experiments on them. Story 11. There are organelles called vaults in human cells and in most other eukaryotic species. They are made of 78 copies of a protein called the major vault protein, totaling about 3 times the size of a ribosome, and larger than most viruses. Their function is not totally understood, but it's probably something to do with the nucleus, though analogs of the genes for vaults even appear in bacteria. As they are found in such a wide variety of species, life on Earth must have started making vaults early in its history. The similarity of the genes encoding vault proteins across diverse species would presumably indicate the importance of vaults for viable life, but experiments haven't shown a great deal of harm done to lab animals that had their vault genes knocked out. Even stranger, several of the species used in laboratories as model organisms naturally lack vaults. The use of these organisms long predates the discovery of vaults in 1986, with some going back over a century. Story 12. Had a pathologist tell me that the interesting part of his job wasn't finding out how someone died, it was seeing everything that can be wrong with someone. So many life-threatening or life-altering horrible things that a person can have going on and still be alive. Good friend died of pneumonia. He was too busy at work, couldn't afford to take time off. He kept using OTC meds for the symptoms. He died unattended, so the coroner had to get involved. They did an autopsy. His body had cancer in 3 different places. He never stopped. Dude was old-time tough. Reply 1. There was a study in a Scandinavian country that did breast biopsies on women of a wide range of ages who died of non-cancer related reasons, accidents, murder, peacefully in their sleep. And it was something like 15% of the women had cancerous clusters or something if they had found during their life they would have been treated for breast cancer, ranging from stage 1 to stage 3. And it was really spread across the age range too. Also, most men get prostate cancer at the end of their lives, but they can just live with it. It's one of these contained cancers that seem to not metastasize. Reply 2. Wow, I'm so sorry for your loss. Your friend's story really hit a nerve with me. Just before the pandemic started, I had a virus causing a cough. I was really busy at work and just kept going until one Saturday I felt exhausted and went to the out-of-hours doctor. I had pneumonia and a UTI. I had to take 3 weeks off work on bed rest and take antibiotics and steroids. I realize now that I had walking pneumonia like your friend, but my luck was better.
Thanks for watching until the end. If you have a similar story to these that you want to share with us, please leave it in the comments below. If you enjoyed this video, please leave us a like and subscribe. For more videos like this one right now, please stop by our channel. Thanks again, and see you next time.